people are like, oh my God, like this must be serious because they're putting off the stuff that's quite important. So I'm not saying that we should go in there and be fully open. And some might argue that this is just semantics, but it's not. It's how we've educated patients, and it's the value that we put into the dental work we provide. I feel like with social media, you can educate patients, and today it might be educating people about the PPE and the way you deal with infection control at your office, and how, that has always protected us from viruses, and maybe new changes that you might be doing now. Again, this is kind of a nice push. We're like, well, if it catches 0.3 microns, why not? Like, why not have that? Like, for the cost of getting a small filter in a room, or a larger one in the waiting room or in the ops, we got to see the silver lining here and really push our infection control to be improved.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 222. I like that number, by the way. That's a good number. And my name is Andrew.
And this is Michelle, and thanks for coming to the hopefully back to this podcast. Maybe it's your first time. I don't know. But if so, if you're quarantined and you just ain't got nothing else to do, so you're like, let me check into some dental hygiene podcast, welcome. We got lots of them. We got lots of episodes.
222, as we just said, and more. There's
actually more, so much more.
Yeah.
Episodes and bonus episodes, all kinds of stuff. But we hope that everyone is faring well, staying healthy, not going crazy, but crazy is probably better than dying of COVID. So,
wow. Okay. That took a weird turn. You know, what's interesting though, is I feel like I know I should be more down in the dumps about all of this, but I'm really enjoying the time to actually get to all of the projects that I meant to get to for years. And I feel like I was telling my dad all the time before, he'd say, hey, well, why don't you fix this? I'm like, I just don't have like the desire to do the outside stuff. And then I keep sending you like new videos and new pictures of like, hey, I pressure washed this one. Like anything that needs to be pressure washed or could withstand the pressure of the wash gets pressure washed.
You're doing
right
it
now.
Man, I wish you lived closer.
It's so
I'd
good.
put you to work.
We're going to redo all of our fence. We're going to redo the whole backyard. We're going to do like all these things that I'm capable of doing these things. I know how to do these things.
You just don't have the time or desire when you're working 40 plus hours.
Yeah. And I don't know. I do feel kind of bad about it, but at the same time, I'm like, well, also the weather sucks here. Pacific Northwest weather on the west side of the state, by the way, you suck. And I'm not right now. It's sunny, but generally it's rainy and gross. And so you have the algae and the molds and the mildews all growing up everywhere. And it's super, super annoying.
Well, I'm glad you could be home when it was sunny and you can get some of that work done.
So here's the other thing, right? We're not supposed to be traveling, not supposed to do all these things, and it's killing me.
Mm-hmm.
But Scott's Cheap Flights keep sending out alerts. And I just got one today from Portland to Bali for $346 round trip.
Shut your face.
Normally $1,400. And I'm like,
is it or is it refundable?
Yeah. Well, what they're doing is they're actually pushing it out to like July. And so they're not going to give you any of like the close-in date ones just because like no one knows what's going to happen. And so he's like, well, you can do this. And there's some dates like next January and February even.
Wow.
So I'm like, well,
for anyone who is just tuning in for the first time, we're a dental hygiene podcast, but Andrew and I love to travel and see the world. Like that is a hobby of ours, 100%. And so we have subscribed to a few of these like sites. Well, I do Next Vacay and you do Scott's Cheap Flights. I do that one too, where we get these flight deals. And like I went to Italy for $400 round trip, like once on these things. So yeah, I am thinking I might travel. Like I feel like I need to after this and just see the world while it's cheap.
Right. But is anything going to be open though? That's the question.
Yeah. I mean, I don't know. And quite honestly,
your social responsibility?
Who will have money? Who can do this with very little money? Because none of us are making very much. And I mean, these are just very interesting, scary, but also eye-opening times. Like I think a lot of people are really taking the time to kind of get back to the basics and really thinking about reconnecting and what are the things that you took for granted before this? I don't know. I'm loving staying home though.
Do you feel though that there's something wrong with us trying to is it too soon to look at the positives of this devastating disease?
No, I don't think it's ever too soon. And, I can definitely be super grateful that I have not contracted this virus, and I don't know anyone who has. You were mentioning like your daughter, you're concerned about her. And then when you said that, I was like, holy crap, my mom has history of TB and pneumonia for months and months. So like her respiratory system is shot. And I'm like, oh my gosh, I didn't even think about that. Like, I do know people that could suffer from this horribly. So I'm just trying to be grateful that I haven't been personally affected by this. I'm still trying to do anything I can to support my friends who healthcare workers so they don't get it. I'm giving them nose filters. I gave them all of my PPE. I'm not even going to be able to see patients when we do go back because I gave it all. I rated my mission trip supplies and if I need to make them food, our local dental community. So we have a Facebook page called Carolina Smiles Group, and a bunch of us got together and donated pizza to the hospital as a thank you from the dental profession here in Charleston. So, I think it's just like, we got to find that silver lining. And, I'm really grateful that I don't know anybody, but also that I can stay healthy enough that if I'm needed, then I could go help.
No, that's good. I mean, I agree with you on it's not too early to think about the positives. Let me ask you this, though. Is it too early to start thinking about what we need to do to get back into the op? Like day one, what is that going to look like?
Yes and no. So I did a webinar last week about shutting down your practice and like all the things that you need to do. And I think that needs to be the things that you're thinking about. Like, what can I do to close down my office for weeks, maybe months in a lot of cases, so that when I do come back, the equipment's there, right? Like that's kind of where I feel like my brain is right now. Like, are my water lines good? My suction's good. My amalgam separators are good. All the stuff, right? But I'm not there yet, like to go back. I'm more focusing. Yeah, I don't know. I just think it's too soon because you just don't know if it's going to change.
Mm-hmm.
It's like, why am I getting my hopes up for April 30th? I don't know. It might not be the case.
Right.
And then also, I don't know if I could see patients because I don't know if I'll have the right PPE, even treat patients when I come back. So I don't know. Maybe I might on a weekly basis kind of just take a moment and be like, do I need to do anything? Do I need to plan anything? But outside of that, I'm just letting it be.
That's the one thing that I just get really nervous about is like not being in a position like right when I'm walking into the op. Yes, the equipment has to be there, but then like, I mean, I use sharpen free instruments, so I'm not too worried about my instruments. But like, I remember
sharpened my instruments? Like literally this morning, sharpened my.
Well, see, and that's the thing. I don't think a lot of people are thinking about that kind of stuff. Is like, not that we have the funds to order new instruments, but like, is that, kind of the direction that we need to start going? Is like, do we need to be ready to hit the ground running? Because if we figure it out where it's safe enough for us to be able to see patients, then I think that there's probably going to be maybe times we're going to have to work late because we're going to squeeze in that last patient. And on all those different things, like I think the screening is going to be there to make sure we're being safe, and the PPE is going to be there for us to be safe. But once that happens, we're going to be seeing more patients than ever, I think, because we have to make up for that backlog.
Well, I think with unemployment means a lot of people lost their dental insurance. So I don't know if like outside the everyday dental practice is going to have an influx of people. And I think probably there's a level of fear too. Do I go back to the dental office? Do I go back to a lot of places? I actually wish a lot more people had some fears of leaving their house, but I'm like, I don't even want to leave. Like, I think about like even going to get wine. I'm like, do I need it? Like, when in my life have I ever questioned needing wine? Like, it just has never happened. And like, these are special times.
Yeah.
Special times.
Yeah.
the things that I am questioning is like, when you go back, think about like all the expiration dates of things, maybe if you activated your enzymatic cleaner for your ultrasonic, that's probably not going to be good anymore. Like just thinking about those little things, that's where my head is. Like, what's sitting there? Can I go to the office? I can go to my clinic because it's attached to a food bank. So the food bank people can let me into the op, but nobody's there. So I've gone and I've done my water line testing and purging the lines and all the other stuff that I am able to do. I grabbed all my instruments so I could sharpen them, all that jazz. So in addition to my water line testing that I was doing while I was on this little break here, Zerk also has a kit or a box, I guess you would call it, called ZOBE, ZOBE. And it's an acronym for Zerk's Organizational Box of Efficiency. And this girl is all about organizing right now. So the thing about Zerk, and Zerk was one of our original sponsors. Yep. Yay.
They took a leap. They loved it. It worked really well for everyone. Thank you again.
So we love them even more. But Zerk is all about organization, color coding, making sure everything is going to be where it needs to be, but also follow infection control guidelines. And so that's kind of what I'm doing right now, is making sure everything is organized. And not only are they going to send this box, but it's not just about the products, it's about the customer service behind it. So they are going to sit with me and we're going to talk about what products would actually work for my particular clinic, because all of our clinics are different. And when we look at the OSHA standards, it requires us to have a standard operating procedure specific to our practice. And so you can take this box of efficiency and really work with their customer service team that will guide you to pick which products are going to be right for your practice. Even like the B-lock trays where we're transporting our instruments from the room to the reprocessing area, all the way down to like your burr blocks and things like that. I mean, it's super cool, but it's not just about the product. They're there to guide you. And I don't think a lot of people take advantage of that, but these are experts in organization and efficiency. So it's just like a cherry on the top where you get this box and you're just like, what the heck is this? What am I going to do with it? Don't you worry. They got customer service that will guide you for your particular practice. So thank you, Zerk. And go check out their ZOBE, ZOBE at zerk.com/get-organized/ZOBE. And that will take you right to the ZOBE box. Otherwise, you can just head over to zerk.com for more information. But I got to say, one thing that I learned with my surgery that happened almost a year ago, one of the things that I was really regretful of looking back on that was pushing things too far, not looking at that time of recovery and relaxation and appreciating it. And I was like, when am I getting back? I got to get on another plane. I got to get back to seeing patients. I got to do this thing. I mean, you saw me like I was a maniac. Like I got to get back. And I was having a really hard time recovering. And I'm not saying that people are recovering, but what I wish I had done was slowed down and been in the moment a little bit more and appreciated that time to sit and relax and recharge. And I think that this is the time for a lot of people to reconnect, to spend more time with their kids, have more time to meditate, let their bodies relax and rest, and those shoulders and wrists and neck problems all kind of go to the wayside. Start doing good training to maybe strengthen them, stretch. I think there's just so many things that we could be doing. However, I don't know. Do you feel like people are doing a better job of this? I feel like 2 weeks ago, everyone was real high strung. And then last week, everyone kind of settled into it. And we're like, we got to find that routine. We're not going back anytime soon. I don't know. Maybe that's just me.
No, I think your observations are exactly what I was thinking. And numbers wise for the podcast, like we saw a little dip that first week and then it climbed back up the second week. And now it's starting to get back to normalcy, which I think is a fast recovery because it means that people are getting back into their routines. I also was reading some of the podcast business stuff that podcasts have taken a little bit of a dip because people are not on their commutes like they used to be. They're out of their exercise routines like they used to be. And so if you look at just those numbers, things are recovering. People are starting to take care of themselves probably a little bit more. They're getting back into the exercise routine, going for a jog or a run or whatever they like to do. But yeah, it was crazy and confusing, and people were running around with their heads cut off, and they're just like, I don't know what's going on. And so, yeah, I think things are getting back to normal in that way. I was just reading something about the apps that are going on right now. They have all of the self-fitness apps are like just exploding, going through the roof. People are loving them, downloading them and using them. So I think that people are starting to take care of themselves. There's a lot of stretching ones. And I think the hygienists are probably right in that same group with everyone else.
Yes. I will say, if I could give a few things that I miss my yin restorative yoga. I went twice a week when I was home and I loved it. I missed the gym. I really do.
Yeah.
Which is crazy because I used to hate it. I'm like, ugh, I gotta go to the gym. And now I'm like, oh, I took it for granted. I did.
It's the freedoms. I think that, yes, you probably do miss like the endorphin rush and things like that from doing those. I think that the yoga one is a little bit different, but going to the gym, I think that there's a ritual behind it that's nice to get back into the routine of it. But I think that there's also, while you don't work out necessarily with a partner, but there's other people working out, doing the same thing that you're doing. You get out of the house. It's an excuse to get out of the house. Like there's a lot of reasons to love it other than the actual doing of the exercising part. There's a lot of things that you can miss about it. And I understand that. That makes sense.
Yeah. So we won't yammer on too much because we have a really great guest. He's he's Insta famous.
Yeah.
Dr. Brian Baliwas. Am I saying that right? All right. Because I butcher those names, y'all. And he's SFDentalNerd on Instagram. He's got a really cool Instagram account. We met him at Voices of Dentistry and we switched up this month. Like if you listened last week, you probably heard me say like this was going to be the beginning of a series of HPV and because this is Oral Cancer Awareness Month. And so things have changed. So we wanted to bring you content that was relevant to you right now in this moment. So we're going to have a few guests on that I hope will bring you some good information, but things that you can think about and use right now and while you're in quarantine.
Yeah.
So I hope you guys enjoy this interview with Dr. Brian Baliwas.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
Welcome, everyone, to the interview portion of this here podcast. We have our guest today, Dr. Brian Baliwas, also known as SFDentalNerd. We're happy to have you. Thank you for making time.
Yeah, this has been in the works for a while. We've been trying to coordinate schedules, and the stars have finally aligned, and the moon is full. Here we are.
And a virus came out, and it gave us all the opportunity to sit and chat.
I have nothing to do this month.
Nothing but time. So you are in San Francisco, right? So how long are you closed down for?
It was supposed to be till April 7th. And so we frantically were trying to reschedule patients. We still see some emergency patients here and there, but for the most part, we rescheduled people to after the 7th. And then now that's been pushed back till the end of April. And so now we're rescheduling people again. It's tough. It's really tough, especially in the city. It's luckily there's been people who've been gracious enough to, help us defer payments and rent even. But it's still kind of scary because it's not just for me. It's for my employees. I'm responsible for a lot of different things. So,
yeah, we're closed down here in Washington until middle of May. And then Oregon, I think, which is right between us, is in June right now. So
yeah,
it's some scary crap.
Yeah.
How are your patients taking it? Are they like, yeah, no, I'm totally not coming in for my dental appointment? Or some of them are like, wait, why? I got nothing but time to come in.
What's interesting is when we shut down, I want to say like 3 or 4 weeks ago, right when they did the shelter in place in San Francisco. And you would think that I talked to a bunch of people on my page and they were saying, oh, we had to shut down because people were canceling anyway. And we have these giant holes in our schedule.
Yeah.
We actually had a full schedule. And as we tried to cancel people, we had a lot of people kind of angry or upset or just didn't realize what was going on. And even our staff was like, I don't see what the big deal is. So we actually had to force our staff to say, you know what, like we've got to have you working from home. But a lot of that is because of how we've kind of trained our patients. We've brought a sense of urgency to this treatment. It's not elective care like the ADA or the CDA might call it. Yes, you have some people who, they're on 6-month recalls. They skip a cleaning, not a big deal. You have some people who have some incipient decay between teeth. It's been there for years, probably not a big deal. But then you also have some people who have decay that's really deep next to the pulp, or, serious issues that you say, look, like this needs to be addressed now. And I feel like the opposite has come about, where all of a sudden now we're going to have to dig ourselves out of this hole and really educate our patients again about the urgency of some of this stuff. So when you ask about my patients, it's interesting because with the rescheduling, we have some patients who are understanding. But for the most part, a lot of people are not to say upset. They understand the situation, but they want to come in.
Well, that's nice. And I do agree. I don't know why we're using elective, like it's highlights, like you're getting your hair highlighted. Like this isn't elective. Like I don't feel like blood work from a medical provider or, your routine like mammograms are elective.
What's interesting is I've been saying this for, a few weeks now, which is if we actually said like, no, this stuff's pretty necessary, but there's something going on right now that's even more important than that, and that's how serious this is, then it's a win-win because people still believe that what you're doing is important. And on top of that, people are like, oh my God, like this must be serious because they're putting off the stuff that's quite important. So I'm not saying that we should go in there and be fully open, and some might argue that this is just semantics, but it's not. It's how we've educated patients, and it's the value that we put into the dental work we provide. So it might just help out with a shelter in place or people staying at home if we kept the value of what we were doing up high.
So how are you doing that for your practice? Because what I would love to chit chat about today is like you're just marketing your practice in a very different way. You're getting your patients from social media, which is, something that is very new to dentistry, and probably the old school folks would look down upon it.
Yeah.
Because they don't understand it. So I'm curious how, you're pretty innovative in the world of marketing. What are you doing to kind of keep the importance of dentistry in mind, but also push forward the fact that staying at home is super important right now?
So it's interesting. A lot of people look at some of the stuff I'm doing on social media and they see it as this new thing that's happening. I really see it as the same thing that's been happening for decades, just with a different medium. And so, if you rewind 30 years, you'd find these dentists who are very educational. They educate their patients about what they're doing. They don't treat them like just a number. If somebody comes in, there were some dentists back then who would say, look, like, here's what's going on with your teeth. Here's how this affects this. Here's the overall plan. Here's what would happen if we did the plan. Here's what would happen if we didn't do the plan. And here's the benefits and other things you could do if you can't afford this. They really educate their patients. And then on top of that, if they wanted to get patients in the door, they would provide great value to the patients they already had who would refer. Or on top of that, they would go out and join parts of the community. So they'd maybe get patients from their church group, or maybe they'd create mouth guards for their son's little league team. They provided value to a community, and then that community in turn would say, wow, like, you're a dentist, like, I want to come see you. I want you part of my life, part of my healthcare, part of my team. And that's how you market yourself. Well, fast forward now to today, and I'm just doing that with social media. So I feel like with social media, you can educate patients. And today it might be educating people about the PPE and the way you deal with infection control at your office, and how, that has always protected us from viruses, and maybe new changes that you might be doing now. Again, before this COVID-19 stuff, I was using it to educate patients about why it was important to get treatment, consequences of not getting treatment. Sometimes I'll educate patients about insurance, but really it's just the social media is just the vehicle I'm using, and I'm just maybe reaching a different demographic, if that makes any sense. So that's kind of how I've been using social media. And then in terms of the marketing standpoint, you're right. Like, there's just a bunch of people on there who are looking for information. They see, you can portray yourself however you want on social media. You can show people your passion, what you're into, the type of work you do, the type of office you have, the type of team that helps you out. whatever you want. I mean, you can really, it's an open book there. You can share as much or as little about yourself. But whatever you feel comfortable sharing to a new patient that walks into your door, that's what you should share on social media. And I think that portrays you in a genuine light and attract, like, what's the saying? Or like attracts like. Is that what it is? Mm-hmm. Mm-hmm. And so, if people are into what you're into, you'll develop a practice of really fun people who kind of think like you. And that's what's happened with how I practice now. I've built a good practice of people who value my work, who understand what we're doing, and they're invested.
When you were creating your social media, I mean, was that always the start of like, hey, I want to partner with my patient base, or was it also I want to like partner with professionals? Because I feel like right now when I look at you, you have a pretty good mix of public education, but also professional education.
Yeah, it's been interesting. So my page has transitioned so many different times. When I first had it, I was a dental student. And so I used my page to connect with just my friends and my family. It's just kind of your run-of-the-mill Instagram page, and then I started sharing things dental, and I'd connect with dental students and my classmates. And then I became a dentist and kind of said, well, I wonder if I can use this to get patients. So it was more of like the patient education standpoint of things. And I kind of did things generic, things that I probably wouldn't recommend now, like posting ads about free whitening and educational videos about how to floss. That's kind of what I did there. And then eventually I started sharing little things that affected me on the daily that other dentists could connect with. And all of a sudden, I think the CDA or I forget who, somebody reposted something of mine and it went viral, air quotes there. And I started getting more dental followers. And then it just started turning into, like social media should really, and again, this is just my personal philosophy, it should be something that adds to your life and something that you should be comfortable with. So it really is just kind of my life and my page and what I feel comfortable sharing. So I don't think I have a specific demographic. I still get new patients from my page. I connect with doctors and other dentists and colleagues. I connect with dental companies, learn about products, and I connect with mentors. I think right now it's just more so sharing my journey. And it just so happens that some people connect with those stories of mine, whether it's me trying to get into dental school as a pre-dent with bad grades, or as a dental student trying to struggle through that, or as a new grad trying to figure out associateship and I'm coming out of dental school and I'm doing a lot of cleanings and I don't know if this is what I signed up for. And then now my story is kind of, I decided to buy a practice and how do I get that up and running and how do I get it successful? And then right at the peak of our success where, this month it's supposed to be our best month ever. Now it's, yeah. And our 1 year anniversary is April 1st. So, we had this nice dinner planned, my partner, Adam Miller, and I, and now the story I'm kind of telling is, wow, survival mode. Like, well, how do you get through something like this? And so I've just been sharing, my page right now, I've been sharing links on COVID-19 stories that are both positive, negative. I don't know, just information. I don't think I have an agenda necessarily, except for the fact that going back to what we were talking about earlier, I just want people to value the dentistry. Like we can't keep calling it non-essential or be fearful of, I've had a couple emergency patients in my office already who have said, yeah, I called my dental office and they said that they could not see me, that I'd have to just go to the emergency room. It's like, okay, so now we're sending somebody who has tooth pain.
Opposite of what they're
Right.
But you have to realize we've created this hysteria. And my statement there isn't downplaying COVID-19. It is serious and
No.
people are dying, but you signed up. You are a dentist. You have the opportunity to help someone. And I get it. There's a little bit of risk and people are asymptomatic. You don't know who has what. But there's a lot of things that you can do to screen. I mean, before all this, we didn't know if people had TB, right? And how did we know that? We asked questions on a health history. If you go to, 95% of health history forms, one of the first questions up top is specifically, have you ever had TB? Have you been exposed to somebody? Do you have a cough that's persistent? you're not asking specific questions about other stuff. You're not going, do you have a runny nose? Do you have a fever? No, it's like TB is specific because we were screening for that because our PPE at the time did not help protect against that. So if an emergency patient calls, and again, this is just my personal opinion, I mean, a lot of the appointment is done over the phone. Well, what is this pain? Can you send them to the right spot to minimize human-human contact? If they need a root canal, for example, or if you think it's endodontic in nature, can you send them straight to an endodontist rather than seeing you and then an endodontist? Screening questions, obviously, if we back up just a little bit. Have you ever been exposed to somebody who has COVID-19? For the last 14 days, have you had a cough that's persistent or, a dry cough? Have you been traveling in the last 14 days? Have you been sheltering in place in the last 14 days? Or have you been out at the beach? Because those little things, you're going to have to make a judgment call. You're a doctor, a dentist who needs to treat this person. And you can't just pawn it off and say, well, it's a crisis right now. I don't know who has what. So I don't know if that makes any sense. There's a lot of screening that's involved that minimizes your risk.
Sense. And it's really interesting to see the gamut of providers, though. You have those that are like, no, go to the emergency room. And then you have others that are like business as usual. Like, how many people can I get in that were supposed to go to the dentist?
But that's the thing, though, is it all comes back into like that education. Like, are you reading the mandates that are coming out and understanding them to the same level as maybe some of the other doctors? And I feel like that's where the education is being lost. And generally, like, look, I don't want to like just crap all over everyone, but like you do see that the pendulum
swing is pretty wide.
Yeah, it's a bell curve, right? Just like everything. You got people on both extremes. I think my point of posting as much information about it as I can is to get people thinking. It's funny because I've had some people go, I can't believe you posted that article, because, and then they have their opinions about it. And I see it both ways. And I go, I'm not trying to say one thing in particular, because I think in the end, we have to realize we don't know a lot about this virus. But the idea is we should be thinking. Everybody's out here looking for the answer, whether it's through the ADA, what should I be doing? Or the government, what should I be doing? How about what information can I get so that I can make some decisions as an educated, you have a degree after your name, right? And it gives you the freedom to kind of think this out and act like one. I mean, everybody's saying, what are you going to do when somebody gets sick at your office and it's because you saw that emergency patient? I'm going to say, I don't think I'm doing anything ethically wrong. And I'm going to say, look, I've screened them. This is what I did. This is the PPE I use. It's in accordance, and I think it exceeds what's actually there. I think if you present that to a jury, you're going to come out on top. And maybe that's just me being naive, but I'm taking a little bit of responsibility of what the treatment that we provide.
Would you recommend, though, that they document all of the things that they're doing, including the PPE that they're using during this time?
Yeah. I mean, I write crazy notes already. And so I've been doing that. And along with the questions to the screening questions that I give. And I posted a consent form. And if people follow me, they know I'm kind of like anti-consent form. But I am using it for this, again, just to kind of give people the true reality of what's going on. On this consent form, it says it's been recommended by all these organizations that we only see true emergencies. And what I'm trying to use a consent form is to fish out those people who just want to be seen. And I think it's a good thing and a bad thing, but I have patients right now who they just don't care. I mean, they want their treatment. And I almost think it maybe is my fault. I've made it dentistry so important to them that they're willing to come in and not listen to the governor or any organization and say, I want my Invisalign trays. I think I document that and having them sign and initial all the aspects of the consent form are good. And again, I think it's intent. Again, if somebody looks back and says, oh, I can't believe you were open. It's like, well, look at my schedule. I came in, I went to the office. I opened up the office with Adam. So it's 2 doctors. I didn't bring my staff in. We set up, we treated this person, and then that was it. I mean, I don't think that's a big moneymaker. I don't, for people who are saying, oh, I can't believe he's putting money first. It's like, I don't think we're making a lot of money coming in and opening the office for one emergency patient. I don't care what the procedure is.
I don't feel like that's even an argument. Like, you're being asked to see emergency patients? Like that's what you're being asked as a dentist.
Yes and no. I mean, I don't know if you saw that, not to call them out, but the CDA released a statement or a letter that said you should only see patients in life-threatening situations. Okay, so if somebody comes in with a Ludwig's angina, they're swollen, they're having trouble breathing, I'm not going to see them at my office. I'm not going to go in there and give IV antibiotics and it's life-threatening. Go to the emergency room.
Right.
I don't know if they did that to kind of cover their butts or whatnot. But again, as a guide for guidance for dentists, why not severe emergencies that could become life-threatening or pain? I mean, I still think pain is a good indicator within reason. I mean, we all have that one patient who's like, it's just really sensitive when I eat ice cream. Yeah, just
when I chew on ice, it's really sensitive.
Just don't eat ice cream this month. Yeah, exactly. Yeah, again, the language has just been a little vague there. And so in California, there are some dentists who are taking it to heart and they're seeing no one, because if it's life-threatening, you're not seeing them.
But how much of it is you as a doctor in California, how much do you weight the advice of the CDA compared to maybe government officials and more like regulatory officials?
Loaded question, and I'll admit this on your podcast. I'm kind of a huge libertarian, so I don't really value much of the opinion of the government or any of that to begin with. I think, again, this is just my personal opinion. I went to school. I dedicated a lot of my time to learn, to take CEs, to learn as much about my craft as possible so that I could make some decisions that are responsible. I mean, I think that requires a lot of ethics, right? Because I could have easily said, well, I just bought a practice. We have a lot of loans to pay. Let's just open for another week and then shut it down. So for me, it's just more of taking charge of myself and doing what's right by my team, by my patients, and by myself. But there are some people who live and die by what the ADA CDA says. There are some people who live and die by what the government says. And there's some people who live and die by what their peers say, right? Like they have their mentors that they reach out to, or the people around them, or their neighbor. I don't know. I think this is a good exercise in just personal responsibility as dentists. Like, what are you going to do? Like, doctor, this person is in pain. Their only other option is to go to the emergency room, where there might be a dozen COVID patients waiting their turn as well. You know, you're worried about your PPE. What PPE does this patient have going into the emergency room? And then we can compare, you can bring up the other topic that gets brought up is the use of PPE. There's people who go, well, if you're seeing patients, that means you have N95 masks and you shouldn't be having those. You should give those to the hospital so you can save lives. It's like, okay, great. Now you have this patient who's in pain. You send them to the hospital. How much PPE gets used on your one patient? Again, I don't have a full staff working. I'm just coming into my office and helping out who I can.
No, I mean, that sounds like the appropriate approach to this. And again, you just have the pendulum swing of one side that's like, nope, they said no one, not going to see anybody, not going to rob anybody of PPE, but you make a very good argument for your one PPE for that patient versus a nurse, a doctor, whatever, whoever's coming into that room to treat that person that might go to the ER. But then you have, like in my state, they're like business as usual in some of these offices, prophies, ultrasonics, whatever you need, we are here for you. And I'm like, come on.
There's even ads. Have you seen these people who are consultants telling those people like, you know, this is the time to be open so that you can cash in on patients whose doctors are closed. I mean, again, there's an ethical issue here too, right? Like an ethical dilemma. I think you see people's true colors when this happens. But I think it just comes down to why, to talk about your first pendulum swing. If you are closed, why are you closed? And there's a couple different reasons that I would agree with, and there's some that I disagree with. Like if you said, look, I have a family at home. I take care of my mother who's immunocompromised. I'm genuinely fearful of catching this, or my team, you know, I have some patients or some team members who are above 65, or I just want to stop the spread of this virus, and I think that I'm trying to minimize, like, fine. But then there's this other belief, which is, well, I don't want to go in there because my PPE isn't good enough, or this just isn't even important. Like, yeah, they have deep decay and they're in pain, but I mean, tooth pain, go take some Tylenol. Let me prescribe you some antibiotics. There's like a fine line there of why you were closed. And does that make sense? It's not.
Oh, yeah.
There's like a distinction there. And then staying open, again, there's different reasons. I mean, there's some people who just genuinely don't think it matters. I'm curious to see these offices that are open. Like, what are they doing in terms of PPE? Are they just wearing the same thing? Are they screening? It's interesting.
So from my perspective, what I'm hearing, a lot of hygienists are wearing the same PPE all day. They get one mask all day long. They are screening, quote unquote, asking, have you had a fever? Have you been around anybody? And they keep preaching how great their infection control is, which always makes me go, I bet it's not. And my thing is that infection control and the standard of care for infection control, it's a movable bar. And if your infection control standards were even top notch prior to this, you have to elevate that in the time of a pandemic. And if you are just quote unquote business as usual in your infection control, even if that was best practices before the pandemic, I still think you can be held liable in the moment of a pandemic because you did not elevate. You didn't isolate your rooms. You didn't wipe everything down. You didn't remove magazines. You didn't anything that patients couldn't touch, like if you did not become like an extremist. And I joked on a webinar the other day, like where you had a Dexter kill room, like if you were short of that, I really think you can be held liable because you are spreading it. And we're learning more and more about how this virus, stays in the air a little bit longer. It stays on the one I got from infection control today said 15 hours on surfaces. So I'm like, if you're not going,
you got to remember to wipe that. Yeah.
Right. Clean and disinfect. Like there are two steps to these things. And a lot of people don't realize that. And barrier wrapping is a huge part of it. So I'm just like, if you are open, you are treating patients as normal. And let's say maybe you're not even doing hygiene. Maybe you're just running high speeds and you are at your base level of infection control from a month ago. I just don't even know how that counts right now in an epidemic or a pandemic. You got to raise that bar.
Two things. One, you just inspired my next meme, so be on the lookout. I'll give you a tag and
I'm going to create an entire course around Dexter's kill room. An entire course.
So good.
If Dexter's doing better infection control than you are, there's something wrong.
And then two, I'm going to say something, and I promise you, I'm not comparing this to the flu or any other diseases that we've had. This is, yes, much more serious, but I would say that this has improved, like little changes we've done. We've also, to keep things within reason, we've said, okay, is this something that would make us feel better to do if we had an elderly patient in the room? And maybe this wasn't COVID, but maybe the patient before had a cold or the flu. Now, there's certain things that you'd want done anyway, right? Outside of this COVID, just to kind of be sure that this next patient doesn't have that. We've started taking temperatures. We bought thermometers, forehead thermometers, taking temperatures on patients who come in, HEPA filtration in the rooms.
That's great.
We don't have negative pressure yet. I mean, I don't think we plan on it. I think it's not, again, that's kind of, we'll see how that goes. But, we got rid of the magazines. We thought this was a great opportunity to really push our Adam and I's paperless agenda. We've always wanted to be fully paperless. This is a great, I don't want to say excuse, but it's a nice move towards that. Hand sanitizer, people should be washing their hands anyway. And so this is great. Like, encourage that. I don't think that's necessarily overkill, but you're right. There should be some sort of, if you're not doing the things that most people don't think is overkill anyway, then you might be held liable for that. I don't know. That's just my 2 cents on that.
I was just wondering, like, what will change with your infection control and PPE after all of this? And would you market that and advertise that?
Like I said, we started taking more precautions. And again, this is just my opinion right now based off of what I've been reading, because there's so many conflicting things in early studies right now. But my thing is, You know, the N95 mask might just be the push. Again, this is just my prediction. I compare it to, I've talked to a couple older doctors back during the AIDS HIV epidemic. Doctors weren't wearing gloves, no masks. It wasn't a big deal for somebody to just stick their finger in there and go to town. And because of this, it pushed PPE that way. Now, at the time, there were people who were like, I'm not wearing gloves. Like, I can't feel endophiles. Like, this isn't going to work for me. Fast forward to today, if somebody said that right now, you'd look at them like they're crazy. So there is a little bit of crazy there where some people might go, N95 masks, that's so crazy. When it comes down to stuff like this, it comes down to the risk benefit, the trade-off. You know what I mean? You're going to switch my mask. I'll be honest, it might be a little harder to breathe in an N95 mask, but I've been doing it. I don't think it's a big deal. So I don't see the trade-off if you were to switch masks other than cost. But again, if it improves your infection control, then cost shouldn't really matter. Now, there's other things that if you're going to make a change like that negative pressure room, for example, you're going to have to really analyze the cost. And not only that, but the benefit, right? Is that coming out of fear? Because even the N95 mask, if you ask most people why they'd want to use that, and I'm not talking about people at the hospital who are treating COVID-19 patients. I'm talking about your average dental procedure, you know, after all is said and done, and this is calmed down and we're screening properly, like, is it needed? And that's where studies come in. We have to look at science and say, like, you know, what is the trade-off there? Like, is it actually needed? So in terms of the changes we'd make in our office, like temperature, lots of screening, paperless, we put in filtration, but again, that I don't think that some of the filters we have actually catch particles that small. But again, this was kind of a nice push. We're like, well, if it catches 0.3 microns, why not? Like, why not have that? Like, for the cost of getting a small filter in a room or a larger one in the waiting room or in the ops, we got to see the silver lining here and really push our infection control to be improved, but also not negate, you know, what we have been doing. It's a fine line.
In regards to the mask has never been meant like our level 3 for aerosols. It's always been for spatter and spray and maybe some larger aerosol production. But the moment you take the mask off, it's in the air. It's lingering there for 20, 30 minutes and travels 4 to 6 feet outside of the aisle. It was never really totally about the mask. It's about preventing it from going from the handpiece, ricocheting off the tooth and then outside of the mouth. And that's where your high volumes and ways to contain it and eliminate it come into place. And then the mask is the next step and next barrier. And also a level of protection for the patient from you. Like, that's where that mask came into. I think you're right. Like, we have to really have more studies, 100%. But I think we're also putting a lot of weight on one very specific PPE. And going back to the HIV crisis, where these dentists were like, I can't wear gloves, I can't touch, handle files, I can't do all these things. And of course, now they can. That's because we trained through it. Like, we trained up, we leveled up, we learned how to deal with it. And I think we can do that with all of all the things that will come from this. I said this the other day with utility gloves. They're thick and they're horrible. And when you go drop a burr in infection control or in your sterilization, like, best of luck getting that. Like, you might as well pick it up with your teeth. Like, I just don't know. It's so hard to get those little guys, but you train through it. And I think that's going to be the case. And I think it would be so advantageous of you to market that after this thing and really build that trust with your patients that you are elevating the infection control practices in your office to not only continue to keep them safe, but incorporate these new things like COVID that we have to be concerned about.
Yeah, it's interesting because we're so concerned about what we're wearing, but we also have to consider the patient, right? And so that's where I think the screening comes into play. And then little things like I love that little pre-wash routine. We're having patients right now, I forgot to bring this up, we're having patients rinse with 1% hydrogen peroxide before we even go in the mouth. Now, we've been having patients pre-rinse with stuff before surgeries anyway, right? That's always been a thing. Or before SRPs, sometimes you'll have patients pre-rinse with some sort of antibacterial. What does that really add in terms of time, cost, or, I think it's a quick thing to do. The other thing that we've been doing for a while now is both Adam and I are huge on isolation. So we always use mainly rubber dam. Sometimes we've used IsoDry or IsoLite, but I mean, that's a huge thing. So you isolate a tooth. Yes, there's still stuff on that tooth, but if you're not spraying saliva and aerosolizing that, really, again, this is me being anecdotal here and kind of guessing. I don't know this. I would think that the amount of aerosolized saliva would be reduced with a rubber dam, because if you're truly have a barrier there, I would think that it would be less splash of that. Yes, you still have tooth particles and resin and decay, or, I'm not saying it's the cleanest stuff in the world, but it's definitely not saliva and blood and whatever else is in the mouth liquid wise.
No, that makes complete sense.
The virus load is going to be whatever's contained to just the outside of it. And once you remove the outside, then you're good to go. So yeah, it should be a lot lower. I want to know, after all this is said and done, what is it that is going to evolve from like the clinician standpoint of how they're connecting with their patients?
Again, I think my office, we're not going to change much, because just not to toot my own horn, but I feel like our patients are so well educated. You can pick a random patient in the Rolodex. I look them up and say, yeah, that person knows what's going on with their mouth more often than not. And so from a communication standpoint, for us, it's not going to change much. But I think for the average, this is your opportunity to set up a little bit more one-on-one, or open up lines of communication that are a little bit more personalized. I guess that's a better way to put it. Where, we live in a time now where you should be able to connect with your patients even if they're not in the office. We take proper records. We scan patients, take photos. Our new patient appointment is not quick. And it definitely doesn't start with a cleaning. And so because of that, as a new patient, Andrew, if you were to call the next week and go, hey, can you tell me again about my treatment plan? I could go in there remotely, check out your case, check out pictures, check out all the perio probings and go, here's what's going on. Imagine being able to screen grab with somebody or screen share and say, here's kind of what's going on with your teeth. Sounds like a lot of time, but that could also be something that's pawned off to your financial coordinator or your treatment plan coordinator or one of the members of your team. These days, you can actually bill for some of this stuff. So maybe it isn't a huge waste of time. I think it's going to really revamp maybe how these appointments go. Because even our Invisalign patients, we've had a few Invisalign patients who have said, hey, can I just swing by? We've had to run their trays down all gowned up and kind of slide them through their window. How does that fit? Show me your teeth. That looks great. If something goes wrong, it's like, that's not going to fit. We're going to have to redo X, Y, Z. But for the most part, if you've planned your case correctly, things should go kind of like this. So I don't know. I think I look at it as more of a push towards efficiency, a push towards personalized care. And you're going to get some pushback. There's going to be people we're all resistant to change, right? I mean, if this N95 mask thing goes through, you're going to see tons of people pissed off and lots of memes from me. But I think that's how it's going to change. I think it's just, it opens up opportunities and you've got to capitalize on that.
I love it.
Well, just as a little aside to that, I'm just curious what you think your team could be doing right now to help promote and connect with patients while they're at home and not able to be in the practice. Do you have any thoughts on that?
Yeah, that's a good question. And we didn't even talk about the team. So our team right now, I'll open myself up here. We've had to tell them to file for unemployment. We did not lay them off. We actually have little projects that we've been giving them time to time. So like we have a new hire coming on and we're trying to implement training. And so we had all our job descriptions, which were, when you start a practice, are all kind of generic. So we emailed those out to everybody, said, hey, look through this job description, circle stuff that you actually do, cross out stuff that you don't do, and add things that aren't on here that you do. So that way we can really kind of start honing that in. And from there, we're going to turn that into a training manual, as in, okay, if these are your job descriptions, how do we do this? Now, these are all little projects that you can't really do when you're, full steam ahead. And so this is an opportunity now for people to work at home and kind of still be part of the team, still feel like they're contributing to the office, kind of pushing forward. Adam and I have been at the office. We've been organizing, restocking stuff, kind of looking at all the systems in the office. And then last week we had our first Zoom office meeting. It was really cool. We all kind of logged in, caught up, asked how everybody was doing, and then kind of talked about the changes. And then it helped us also reinforce that, hey, we were doing a lot of things correctly, but there's some room for improvement, just like you said. And so here are some of the changes that you can expect when we come back. Got hand sanitizer stations now. We're trying to minimize paper, all the stuff that we talked about earlier. And so now they're kind of in the loop still. They don't feel like they're lost because they're not. They're still part of this team, and we're still moving forward. If Adam and I could afford it, we'd love to be able to just keep everybody on with their same hours, but that's not really realistic for two recent grads who spent a lot of money on a practice and who have bills to pay. So there's a little bit of that. In terms of your question of how they'd interact with patients, a lot of the stuff, again, we operate low volume. So a lot of the patient phone calls and follow-ups have been on Adam and I. We've got patients who, as we look at the schedule of people being rescheduled, we go, oh, we should check up on that person. Hey, has that pain gotten worse? Because I know we were supposed to do that filling today. Sorry that it's being put off. How's it going? If you have a big team and you trust them, that could be a task that maybe they do from home if you're okay with them working remotely, following up with patients, checking in on them. Yeah. Or, even the hygienists. You guys know the most almost about these patients. Sometimes I walk in and the hygienist is like, oh, this is what's going on. And I go, how come they didn't tell me that? And so, having hygienists, even paying them for a few hours here and there to follow up, maybe having them reschedule if they could. That would be a nice idea. And that doesn't get in the way with unemployment because you can still get, at least in California, you can still get unemployment with reduced hours. And so what they do is they'll just take into account what you've paid them and then they'll reduce the unemployment. But either way, if you've got a team who's really invested and they're not selfish and they're not going, well, I would make the same amount just doing nothing, so I'd rather do that, then it might give people something to do. I know we're pretty bored at the house right now as Mandy's on the ground right now playing with Xylo. I would think that people would want something to do.
Yeah, no, that's totally true. So if we have anyone that wants to reach out or follow you, where can they do that and follow you on Instagram or send you an email?
Yeah, I'm on Instagram as SFDentalNerd, or you can shoot me an email. So my email is Baliwas, DDS. So BALIWAS, S as in Sam, DDS, which is apparently the degree that was given to me at dental school, at gmail.com. So baliwasdds@gmail.com. I respond a lot to all my DMs. I actually, that's me responding. I run my own account, mainly because I think it's fun. So that's probably the best way to get a hold of me.
Nice. Any other little things before we let you go?
No, this is cool. I appreciate you guys having me on. It's always fun chatting, exchanging ideas, and meeting new people and catching up with people you already know who follow you at the airport and whatnot. It's Andrew.
Stalk you.
I know you, but you don't know. Yeah, there's a weird exchange that happened at the airport.
I have no doubt there was a very awkward exchange between you and Andrew.
Brian, before I let you go, can I thank you so much for your time. Can I ask one huge favor though?
Yeah.
So we had a listener and he's actually the one that got us to know who you were. This is, a year ago or 2 years ago. His name's Adolfo. Do you mind giving a shout out to Adolfo?
Yeah. What's his Instagram handle? Do you know?
I will send it over to you. I don't know it off the top of my head, but he turned us on to you, and he's a hygienist, and he loves everything you're doing.
Let's do this. I'm going to screenshot this, and then I'm going to post it with your guys' permission on my page. And we'll give him a shout out, and I'll search my followers.
This would be the day where I gave up on all things.
You look amazing.
I'll stop it.
I think it's the sweater.
Yes, need more coffee. All right.
Thank you,
Well,
Doctor.
Yeah,
so much
thank
for
you
doing
very
this.
much.
Awesome.
Yeah, no worries. Thanks for, again, I know everybody's busier at this time, sitting at home, watching Netflix. And so I'm glad we could all kind of squeeze this in.
For sure.
So lots of good topics, a lot of interesting things that we kind of did some turns here or there, but you should definitely follow him on Instagram. He does have amazing marketing things. And that's in his presentation on at Voices of Dentistry. I even learned quite a lot from him from a marketing perspective about getting dental patients and referrals. And yeah, it's a really good page. And he's really smart and very innovative.
Yeah, and I think the one of the reasons why I wanted to have him on for you guys to all listen to is the fact that he is very pro hygiene. He is not revolutionary necessarily, but like he's on the cutting edge of so many things within the hygiene, and hopefully we'll have more episodes with him in the future to let him kind of explain a little bit more about what he does within his practice. But some of the things he does, I mean, when we talk about, and we didn't talk about on this episode necessarily, but some of the things that he posts about are like the masks. And he'll cite research on the masks. He'll create discussion, sometimes debate on certain topics. And he wants just the very best for everybody. So we're really lucky to he took some time to be on our show.
Yeah, yeah. So if you guys haven't already, we would love for you to leave us a review or rating and review if you have the time. We would very much love that, especially on Apple Podcasts. Please tell your friends, hit that subscribe button if you haven't already, or the ad or a favorite or whatever it is that you're using on that particular podcasting app. You can always email us too at ataleoftwohygienist@gmail.com, or me and Andrew individually. And that's just Michelle at ataleoftwohygienist with an S.com, or Andrew at ataleoftwohygienist.com. And of course, we are on the social media forums and social media, Instagram, Facebook, LinkedIn, all that jazz. And we've been doing a lot of Facebook lives. So if you want like relevant content, like, you're just hanging out, come drink some coffee or wine, depending on the time of the day, hang out with us on Facebook. And those things will be sitting there in our news feed for a while, I would suspect. Anything else, Andrew?
Nope. I just hope everyone is staying safe and doing their part during this crazy pandemic we're having.
Yeah. These are crazy times. We're living through history. Literally, our relatives are, the future generations will be reading this about what we went through, and the idiots who won't stay home. So annoying.
I'm glad you threw that in there.
These people who, I put this on my Facebook page, but obviously people did not sit in timeout as children, and it's really starting to show. And also all the people think that they're essential. And this is what happens when everybody gets awards at school. And you always get participation. You feel super important. And now you feel essential. And this I blame on everyone getting ribbons in school.
Wow. That is a deep cut. I love it. I absolutely agree with all that. Surprised you said that out loud on a podcast.
Absolutely.
Worldwide podcast.
This is the problem. You are not essential. If you're not saving lives, you're not essential. Listen, my Botox is not essential. I'm feeling it. I feel it. It's coming back, but I'm not going to get my Botox.
We'll start seeing her facial expressions soon enough, everyone. It's going to be wonderful.
I much prefer the RBF at all times. Anywho, it's been fun. Thanks for hanging out with us this week. And we hope you have a great week, whatever that looks like for you right now.
Take care, everyone.
Bye, y'all.